dear students of class 2018-2024. It's an honor to present the graduation lecture for you. And I would like to thank the Vice Dean, Professor Jackowska-Tracz, for giving me the opportunity to present you this last lecture. I hope you remember me. I was your chemistry and biochemistry teacher. And today, I initially proposed a lecture entitled The Chemistry of Life. But actually, I will talk about the chemistry of emotions today. But first of all, congratulations, dear graduates. Today you officially finish your student's life at the Faculty of Veterinary Medicine at Warsaw University of Life Sciences. We met in 2018 at the beginning of your journey as students here when we had together chemistry and biochemistry courses. And you were actually the last class that finished the entire biochemistry course before the outbreak of COVID-19 pandemic in Poland. You were also lucky to work with Professor Bogdan Dębski, who was your lecturer and who was teaching you during some of the chemistry and biochemistry practicals, but unfortunately Professor Dębski passed away in 2020. So you've chosen a beautiful but very difficult profession. Veterinarians play a vital role in society, caring for our beloved pets and ensuring the health and well-being of animals. I think that most of you had this ideal image of veterinary doctor who takes care of all these furry and feathery animals like Dr. Dolittle. By now, I think you already know that being a vet is not easy. It's a hard work filled with challenges, nights spent at the, nights spent at the clinic, and stressed patients and stressed owners of these patients. You've chosen a hard and demanding profession that often requires long hours, weekend and holiday shifts, and being on call for emergencies. The veterinary profession is undoubtedly rewarding, and it will allow you to make meaningful differences in the lives of animals and their owners. However, you also will be facing plenty of challenges, such as lack of work-life balance, constant exposure to stressful and unexpected situations, and a need of constant training which involves substantial financial investment. And that can be very overwhelming. But remember, your ultimate goal is to provide quality care while continuing to enjoy what you do. So let's talk about emotions that you will be facing during your veterinary profession. Of course, this is a lecture, so we have to start with a definition. So we can define emotions as physiological states that are generated subconsciously in our brains in response to internal and external events in our lives. We use the terms emotions and feelings, which are connected, but we actually should not use these expressions interchangeably because feelings are subjective and driven by conscious thoughts and reflections. So we can divide emotions into 6 basic categories: happiness, sadness, anger, surprise, fear, and disgust. Today, I will talk about some of them that I think are tightly connected with your profession. So the emotions are created in our brain, to be exact, in the limbic system. This is a very schematic representation of the limbic system, which is composed of hypothalamus and pituitary gland that are responsible for releasing hormones that control our body. Hypothalamus is the master nerve control center, and it releases hormones that regulate the activity of the pituitary gland, that in turn regulates the activity of other peripheral glands, such as thyroid gland, adrenal gland, ovaries, or testes. Thalamus is described as a relay station for all sensory information except of smell. Hippocampus plays a major role in learning, memory, and emotional recognition. But for us today, the most interesting is amygdala, the part of brain where emotions are given. So we can divide emotions into two components or two parts. There is this physical component, which is our body language, facial expressions, tendency, actions, cognitive assessment, and feelings. And then there is this part that we will be talking about today, the chemical component. It's composed of the neurotransmitters that are produced by our brain and regulate the emotion. So the neurotransmitters are dopamine, serotonin, gamma-aminobutyric acid, noradrenaline and adrenaline, as well as glutamic acid. And we will talk about some of them today. So let's start from the negative emotions. I'm sure you will be facing some stressed out owners of your patients and also angry and stressed out patients who don't necessarily know that you are here to help them, not to hurt them. So the anger is driven by two main chemicals, adrenaline and noradrenaline, and both of these chemicals are produced by adrenal medulla. And here is the chemistry part, or biochemistry part, because you actually heard the lecture about how adrenaline and noradrenaline are synthesized. And these are synthesized by amino acids, the exogenous essential amino acids that we do not produce. And these are called phenylalanine, which then can be converted into tyrosine. And the tyrosine is the starting point of production of these neurotransmitters. Both of them are responsible for the fight or flight reaction. And adrenaline allows us to engage in this fight or flight reaction, choosing whether we want to turn away from the danger or maybe we want to get engaged in the stressful situation. Our brain sends the signal to the adrenal gland, to the adrenal medulla, to produce adrenaline, and that increases the heart rate, causing the sweaty palms, flushed cheeks, and other signs of anger. Noradrenaline, on the other side, makes us feel the rush when angry and gives us the strength to defend ourselves. It is also useful for giving us the opportunity to decide how we handle the situation, positively or negatively. Stress is also connected with fear. You will be facing your own fear, but you will be also facing the fear of your patients who come inside your veterinary clinic and they don't know what will happen to them. So fear is a chain reaction that happens in the brain when a stressful situation arises, and the symptoms include heart racing, muscle tension, shallow breathing, and sweating. Fear is also connected with adrenaline and noradrenaline, but all stress is also connected with the release of cortisol from the adrenal cortex. And here our brain stimulates the release of this hormone. The amygdala gives signals to hypothalamus. Hypothalamus produces corticotropin-releasing hormone, and that gives signals to the pituitary gland. That in turn releases the adrenocorticotropic hormone, stimulating the release of cortisol. When cortisol increases in our blood, we also observe the increase of the glucose level in blood, but also there is a signal to our body to shut down the non-essential organs during the stress factor and to alter the immune system. And here again, a little bit of biochemistry, because you all learned that cortisol is one of the steroid hormones. It's a corticosteroid. And all steroid hormones are actually synthesized based on one substrate, cholesterol. We won't talk about these pathways, but you learn the synthesis of cortisol and other steroid hormones. Remember that cortisol is not only released when we are afraid, but also in response to everyday stresses. For example, huge workload. So we need to take care of ourselves to maintain stable levels of cholesterol, because the chronic increased levels of cholesterol can be detrimental to our health. But fear is connected with the release of other two hormones, vasopressin and oxytocin. Both of them are produced by the hypothalamus, but are not released by the hypothalamus, but instead the neurons are carried to the posterior part of the pituitary, and there is the releasing gland for both of these hormones. These hormones are peptide hormones, so they are not made out of single amino acids or cholesterol, but instead they are encoded in our genetic code in the DNA, and the genes have to be expressed by the dogma of molecular biology, which means that we have genes encoding these hormones, vasopressin and oxytocin. They need to be first transcribed to the mRNA and then translated to the order of amino acids that compose the peptides in our body. So scientists noticed that when we release more oxytocin than vasopressin in stressful situation, then actually we are calmer and we can handle more calmly the dangerous situation. Whereas if the release of vasopressin exceeds the release of oxytocin, then unfortunately we observe increasing anxiety and certainly an overall sense of fear. So I wish you all that you will be releasing more oxytocin than vasopressin in those stressful situations. But of course, we have also pleasant emotions, and you will be facing these pleasant emotions. You will feel happy when your diagnosis will be correct. You will feel happy when the outcome of the therapy you offer to your patients will be good. The happiness is governed by dopamine, serotonin, and also noradrenaline. We talked already about noradrenaline, so let's talk about dopamine, which is described as the feel-good chemical. It is released in the ventral tegmental area of our brain whenever we are doing something pleasant and what makes us feel happy. And dopamine triggers the reward-pleasure system in our brain. Dopamine is also one of the neurotransmitters that are synthesized from an amino acid, tyrosine. Dopamine makes us feel good, motivated. It improves our memory and focus. It also urges us to continue doing the activity that is releasing this chemical. That's why we can get addicted to dopamine. Because too much dopamine can lead to addiction, causing the constant sense of having the happy factors that makes us feel good and pleasure. But there is another molecule called serotonin, which is produced in the Raphi nuclei of the midbrain, and it controls the satisfaction and happiness, and it's the molecule that allows us to remain optimistic. It also helps us to regulate the sleep cycles, body temperature, and mood and pain. Serotonin is not made from tyrosine, but it is made from another amino acid, which is essential, which means that, again, we are not able to synthesize it by ourselves, but we need to obtain it from our diet. It's called tryptophan, and the synthesis of serotonin is a two-step reaction. It's well documented that people suffering from depression, the constant sadness, as well as other mood disorders, are also exposed to low levels of serotonin. So remember, to maintain the balanced mood, we need to maintain the balance between those three neurotransmitters: dopamine, noradrenaline, and serotonin. The balance between dopamine and noradrenaline gives us the proper attention, because the dopamine takes care of our motivation and clarity, and it also maintains the working memory. Noradrenaline, on the other side, make us feel determined and also maintains the recall memory. The balance between dopamine and serotonin, on the other side, helps us to maintain the proper appetite, because serotonin is the neurotransmitter that maintains the correct feeling of pleasure and optimism, and also it maintains the learning memory. And finally, the balance between serotonin and noradrenaline maintains the correct endurance. When we feel happy, we laugh a lot. And when we laugh a lot, we release the dopamine as well as endorphins. And remember that laughter can improve our mental health and helps boost our immune system. Now, endorphins are not neurotransmitters, but they are considered to be the peptide hormones. So again, they are synthesized based on the chain reaction of transcription and translation of genes. They are known as natural happy drug. And not only they are released when we are happy, but they also increase the pain tolerance and well-being. And by the end, I would like to talk about love, which is not included in those 6 basic emotions. But when we feel love, or we are in love, we feel happiness. Most people think that love comes from the heart, but actually it also comes from the brain, and sometimes it causes the brain to go crazy. According to Dr. Helen Fisher from the Center for Human Evolutionary Studies in the Department of Anthropology at Rutgers University, romantic love can be divided into 3 categories: lust, attraction, and attachment. And all of these 3 categories are governed by chemicals. So let's start from lust. It's governed by the steroid hormones, sex steroids, so again synthesized from cholesterol, testosterone, and estrogen. When we find someone attractive, the hypothalamus in the brain signals the testes and ovaries to release these hormones, creating sexual desires. Lust is connected with attraction, and attraction is connected with the balance and the release of dopamine, noradrenaline, and serotonin. Attraction involves the reward pathways in our brain, and actually serotonin is going down. We see the decrease of serotonin release when we are in love. And that's why when you hear someone saying that he cannot eat or sleep because he's in love, it's not an exaggeration. But finally, there's the last stage, attachment. And I wish you all that you will create the love, the long-lasting love and long-lasting relationship. And that is actually stimulated by these 2 hormones, oxytocin and vasopressin. Oxytocin is produced in high concentration when we have the pleasure skin-to-skin contact. But the more valuable hormone to maintain the attachment and long-lasting relationship is the vasopressin. The release of vasopressin guarantees the attachment and long-term relationships, and it brings a feeling of calmness, security, desire to protect one another, and emotional union. So I wish you all to have plenty of vasopressin in your relationship. So in conclusions, even the most well-trained vet can be worn down emotionally and you may experience compassion fatigue, especially when you have to deal with difficult cases on a regular basis. So please remember that when you come home from the clinic all worn out and very tired and stressed out, remember that the stress that you are dealing with is all driven by chemicals and that you can handle this situation. But to handle this situation, you need to have some time to relax, to take some time off, to exercise regularly, and to maintain a healthy diet to provide your body with necessary nutrients, also these that contain those essential amino acids, phenylalanine and tryptophan, which are eggs, dairy products, mushrooms, or fish. But my last advice is that when you feel in love or you love, don't think about these chemicals and don't overanalyze it. Just love. Congratulations, dear graduates. I wish you all the best.